What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we're covering how often do we see the burnt out and the tiredness of people who work in radiology, which I mean, to be exact, the X-ray department. So to give you context, I am in a night shift X-ray tech, been doing it for 4 years. I've sat down and interviewed and talked to many of the veterans in my department and other departments who've been, I'm talking about 20 plus, 20, 15, 25. We have one that's 30 years in the game. He's been doing it. He about to retire here soon. But all of them, the few amongst the many that choose to do this profession, I would say you have to be built a little bit different, because especially if you work where I work in the emergency room, and the bread and butter of our department, I would say it is chest x-rays. We will do a one view chest x-ray. I would say 90% of the time that is what you're doing. And to me, I can do that all day, baby. If all I did that day was just chest x-rays, it was a good day. It was an easy day, easy money. But to other people, to the few people out there who feel they need to do more, to do this, to do that, to do different stuff with their professions, I would say that maybe X-ray is not for you, and you can probably later on continue to other modalities. That's what you see. Some of the techs will be doing X-rays for a few years, and then maybe they get tired of it, maybe they want more money, and they'll branch off to the other modalities, and you can continue on doing other stuff. But I would say just for X-ray alone, the biggest burnout is because they just do chest X-rays all day. They feel that what they're doing doesn't exactly make an impact as much as they thought, or because, I mean, at the end of the day, we're constantly, every single day, every single person you see is complaining to you about they're hurting, they're in pain, they're not good. And eventually, certain people, kind of that takes a toll on them. They feel like they have a level of discomfort, like they feel like it's too much. I've seen that side of the aspect. I could probably do this till I retire. Ain't gonna be no problem. Because some people, like, it's too much stress. They, like, take too much. Me, as soon as I leave the X-ray department, like, all the stress just, and I'm like, you get to enjoy your life. Some people, I know my lady who's a nurse, it's a little bit different because they're constantly, like, thinking about the next shift, about what's coming, about, like, because of what careers they have. But me, as soon as I leave, I can just switch off, and I get to go to switch to my dad mode, to enjoy other aspects of life that I enjoy. But some people, it's a little bit different. I've seen people that they can't handle the stress, especially like if you work in the emergency room. Sometimes you get a lot of stressful situations, and I've seen some techs that they'll come in from like orthopedic or from other aspects, and they'll like join the ER because they want a little change, and they see one good crazy trauma, and they're like, you know what, I can't, this is too much for me. Other people like me, when there's a good trauma, a part of me gets excited, not like because of what's going on, because like it's a time for me to show off my skills, and that's one thing that will get me excited. I'll say time and time again, give me a good trauma and the chest x-ray, and you get only one shot. Ain't nothing make you feel more alive than you get that one shot and you were able to save this patient's life. Because sometimes you only get one shot because there's so many nurses, doctors, everything in the way. But anyways, back to where I was talking about the burnout. Other people, especially during this economy, maybe the pay isn't enough for you. Maybe they have a lot of debt, and they see that maybe they need to continue on to other aspects. That's something I've seen. Other times, people choose just to PRN or to do traveling because they want to. Because, I mean, if you work at the same place, you do the same things. Because of how expensive our equipment and all the stuff is, so upgrading and anything like that is very, very few. Like, it won't happen that often. So like there's been techs that have been working at my hospital for like 20 years or 25 years that have been told since the day they got hired that they're gonna upgrade this and upgrade that, and they'll be like, look baby, they ain't upgrading nothing. And I've been here since they've been doing film, bro. And I was like, what? It's crazy. I don't know what to tell you. I mean, obviously they did upgrade from like different, because I mean they were there from film, they went to digital and did to cassette. But like upgrading, like even now, I think we've been on digital, the same digital since like 2015. So it's like what, almost 10 years. 10 years, same equipment, and then they just patch it up and it gets kind of some people I guess ain't built for it. I don't know. I quite do enjoy. Other people will be like, I should have been a nurse, or I should have done this, because I felt like more meaningful life. Like my lady who is a nurse, I can tell you, she does a lot of, like, she helps a lot of people, and her profession is quite like rewarding, but at the same time it is very, very stressful. And I told her I would not be working as much overtime as I did if my job was that stressful like hers. I probably couldn't do it, but she does what she do and she loves it, but it does take a toll on you. And that goes with any medical profession. It does take a toll on you. But as long as you're able to find a purpose and you find that you can keep on doing it, and sometimes I feel like you just need an outside perspective, or to dabble into other worlds, maybe other like jobs and positions, to see that maybe your job isn't that bad, maybe it's okay. Like I've gotten insight of where I work at because of one of the techs that recently got hired and started telling me about her jobs in other places, to which made me think, you know what, this job's pretty good. I shouldn't go anywhere else. And they were getting paid way less money, so you know what, it's a little bit different for everyone. And yeah, I'll keep on making these videos if you're still here, continuing to educate y'all in different aspects of radiology, the little niches. Yes, baby boy Miguel. See you on the next one.